Okay, today is day number 8 of my experience working in New York City in the intensive care unit. Yesterday was my day off, so I got a lot of rest and I felt really strong coming into today. And um, the first thing that I was most interested in was how were my patients doing from Tuesday. And I know that many of you watching this have been praying for them, and there were 6 patients. They were in my heart and my prayers the last 2 days, and I know many of you were following along. And when I went in this morning, to my great pleasure, all 6 of those patients are still alive. They're still critically ill, and that's kind of the balance in all this is they're very, very sick and they're on vents, and COVID is just ravaging their lungs, but they're all alive. And so I just ask that each of you that's been praying with me continue to pray for those 6 and then 2 more that I added today. Just because of the way it worked with me gone, we kind of moved patients around. And so a couple moved off my team and a couple moved on. And so I started with a different 6 today, but some of the same. But please just keep praying for the patients that I'm taking care of, that they'll do as well as they can. I wanted to just take a moment to talk a little bit more about our setup here, because it's hard for people to really imagine all this, but we have multiple ICUs at this point because so many patients are intubated in the hospital. And at a high level, we split them into COVID positive ICUs, where you have the virus and you're in intensive care. And then other patients that are in intensive care, we're a level 1 trauma center in Manhattan with 20 million people that live in this metroplex. And so we have a lot of just normal intensive care patients too. So the one I'm working on, every single patient is positive for the coronavirus. And because we only have a certain amount of space, we have 2 patients in every room. So I just want you to picture that as we're doing our jobs, we'll round on patients, and there's 2 in every room, and every single patient has coronavirus. And so what this has led to is just incredibly different management style than anything I've ever done, and I think anything that most people have ever done. So picture 2 patients in every room down a hallway with 12 rooms. And so there'll be as many as 24 patients, all with COVID-19. And we try to manage them from the hall, just to protect the staff and other people. What we do is we set up these intricate systems of drips and machines. Every patient's on anywhere from 2 to 8 infusions, including muscle paralytics and sedation medicines and IV antibiotics and blood pressure medicines to keep their pressure up. And we run tubing out into the hall, and we shut the doors. And when we round, it's just an incredible sight to see. You'll see all these pumps all the way down the hall with nurses in the hall managing their patients. And it leads to just really interesting interactions. Today I watched a surgery on a patient in our COVID-19 unit. And the surgeons were in the room and the scrub nurse was outside the room. And it was just really a sight to behold. And one of the harder things to watch this week have been funerals that occur over Facetime, because not only can the family members not go in the room, but they're not even allowed on the unit because it's just so high risk for anyone to be here except for the healthcare workers that are taking care of the patients. And so the family members, when their loved ones are near death, social work gets involved, and we'll set up FaceTime videos where the family can get together, and one of the social workers holds the phone, and the family members say goodbye. And it's never the way that you'd ever want to say goodbye to your loved one is over a phone. But it's such a blessing for them just to see them one last time. And every time I see that happening, it really touches me. And I stop and I pray for the family and what they must be going through. We had some good and bad today. We started the day with about 21 patients on the unit. And we discharged 2, including one of my patients, which was amazing. But we also lost 2. And it was, I think that's kind of an example of what we're dealing with right now. We win some, but we lose some, and it all happens so rapidly. As a matter of fact, the one that I was taking care of this morning, we were discharging him, and I was so happy for him. And I was actually waiting and excited to hear the Don't Stop Believin' song that we play every time we discharge someone from the ICU. And it was coming up on, he was about to be discharged, and I knew that I was going to hear the song, and I was looking forward to it. And then the way it played out was so surreal. One of the other residents came in and announced that his patient had died, and it was a somber moment. And literally within like 3 or 4 seconds of him announcing it, before we could even ask a question, Don't Stop Believin' played over the intercom for my patient that was leaving, and all the joy was just sucked out of the moment because of the death that we were hearing about. So it was a day of wins and losses, of good and bad, of life and death, but it was a good day, mostly. I wanted to tell you about one of my patients that I put an epidural in yesterday, and I talked to her mom today and explained what we did. I had to get consent from her over the phone 2 days ago, and so she wanted me to call her back and tell her how it went. And when I talked to her, she was crying, and just so her heart was hurting so bad for her daughter. And she asked me if she could see her, and I said, well, we can have social work call you later and set up a time that you can talk to her. And she said, no, I want to see her now. I want to see my baby girl. And I said, I don't think I'm allowed to do that. I think it's supposed to, I'm new at the hospital. I think this is supposed to go through social work. And she said to me, if you had any children, you would understand what it would feel like to be apart from them. And I told her that I had 5 children of my own, and I understood. So I put her on hold, and I went and asked one of the attendings, like, is this something I can just do myself? And he said, sure, no problem. This is, all hands on deck, whatever you can do. So I downloaded the Doximity app, which I'm going to teach you about below on my final point. But I downloaded this app, and this mom was very elderly, and I didn't think she was going to be able to figure it out. But I sent her a text message, and she entered the chat right away. And so I went over, and I let her see her baby, and she cried, and she asked lots of questions, and I did the best I could to explain what was going on. Just like any mom, she noticed everything, had questions about bandages and vents and the monitors and what they meant. And I spent probably 20 or 30 minutes with her as she looked at her baby girl. Which brings me to my teaching point. For all the doctors out there, I want to teach you in this COVID environment how you can interact with patients. Hopefully not in the way that I'm talking about now, but maybe telemedicine or other ways. So a lot of us are on Doximity. All you have to do is go to your app store and download Doximity, Doximity. And it just takes a minute to load up. You put your information in. You have to get an account. It's super easy. And then you have 2 major features, which I've been using this whole week. The video is kind of new for me, but the other feature is when I first started calling patients, I would hit *67. So every patient in New York didn't have my cell phone number, but nobody answered the phone because they're like, who is this blocked phone number? So no one answered. So then I got desperate, and I just started using my own phone. I stopped hitting *67. I figured it doesn't matter if they call me. I want to talk to them anyways. But then people were like, who's this guy from Arizona calling me? So that didn't work. So then I realized I could download Doximity, and there's an interface where I can put in there, when I call them, it says Bellevue Hospital's calling, and they always pick up on the first ring. As you can imagine, if your loved one's in the ICU. Once I started using this app, everybody picked up on the first ring. And so I plugged in Bellevue Hospital into the app, and I would call the patients, and then I was able to talk to them throughout the day. Now I'm talking to some of the patients 2 times in a day, and it's quite easy. So that's the first part. The second part's the video, and it was super easy too. You have to sign up for it, and it takes 24 to 48 hours to give you access. But once you get it, you can just plug their number in again. They can't see your number. It says Bellevue Hospital. it sends them a link and they have to hit the link. But this elderly lady figured it out today. So I think most of your patients will be able to figure it out. So thank you for watching my videos. Thanks for all your encouragement. Please keep praying for the 5 patients that I ended the day with, because one went home. God bless you guys. Stay safe.